So my name is Martin Stewart. I am CEO of Mikroscan Technologies, based in San Diego, California, and we focus on the pathology market. So the pathologist is probably the most important doctor you're never likely to meet. They diagnose about 97% of all cancer cases through a surgical biopsy. There are some very important procedures which today, if you're having a surgical biopsy, say for breast cancer, the traditional methodology is you'd go in and have a biopsy. The material will be sent to the laboratory, and of course for the patient that's a big worry. With our technology, you can actually do a real-time assessment while the patient is actually on the table. A temporary sample is prepared and then placed in our device, and a pathologist located anywhere with a network connection can actually read the slide and tell the surgeon whether the surgical margins are clean, or do they need to go back and take additional tissue because there's still evidence of cancer cells in the sample. So that real-time assessment means the patient can go home knowing that there's no likelihood of a recall. We're actually now beginning to see less reservations, more adoption, and somewhat ironically, a lot of that was driven by the COVID pandemic. Right, because so many pathologists couldn't show up to work, have families to look after, and they were reading out cases from their homes. And this became a really significant step forward, demonstrating that they could, in fact, use telepathology to solve these issues. About 52% of our customers last year were repeat purchasers. So I think that is a testament to how well the technology works for them and the fact that they can roll it out into additional hospitals. So typically we see the main medical center as the initial user, and then they'll start to place them out into the satellite hospitals. And that really does help the pathology department become much more efficient.